Good evening and welcome to Door County Medical Center Live. I'm Dr. Jim Heise, Chief Medical Officer here at Door County Medical Center. I'm joined by Sue Powers, Door County Health Officer and Public Health Manager.
You got it perfectly. Thank
you.
I
did. I'm practicing this time. It's just like I can't keep making a fool of myself, although, you know, it's easy for me to do that. So it's not. So thank you all so much for joining us. I know these are nothing short of exciting times. I'm sure for many people they can also be maddening times because people have a lot of expectations as to, as getting vaccinated. I want to get vaccinated. It can't happen fast enough, and it's not happening fast enough. So we're going to talk about that tonight. We're going to talk about what's been going on thus far. And frankly, we haven't even started the January 25th date yet as far as when vaccinations can be given to 65 and older, but we're ramping up and we're getting ready. But before we do that, let's talk about what's going on with COVID in general, and Sue's going to give an update on our community.
Okay, thank you. Glad to be here tonight. Disease activity level across the state for COVID-19 remains very high. That includes Door County. And what that translates for Door County Public Health into is about an average of 15 cases a day, and we're able to again do full contact tracing. Some days are less, some days are more. Today we only had 5 confirmed and 1 probable. Our death number has crept up to 18 since the beginning of this, and as of today, active cases are 286. The total ever hospitalized is 79. And just to also cover some other basics, if you weren't aware, Governor Evers' face coverings emergency order goes through March 20th. He renewed that, and the state of public health emergency in the state of Wisconsin has been renewed for 60 days from January 12th. So we're also in that. But we are very excited about vaccines at Public Health, and so glad to be able to move forward and see a little light at the end of the tunnel. We are so close.
Yeah, it's really a really neat thing. So what I wanted to do is I'll start out talking about the vaccine effort here at Door County Medical Center, and then Sue will talk about their vaccine effort. The key to understand with all this is there's no competition as to who us or public health with vaccinations at all. We're partners in this. We're working together in this, and so wherever you can get your vaccine is absolutely fine. So to give you an idea of the magnitude of where we are right now with Door County Medical Center, yesterday, as I think many of you probably know, we went live with our online scheduling form, or our online request form, at about 3 o'clock. We had set up extra licenses for all the different behind-the-scenes information technology stuff that you have to do, which should have easily taken care of over 100,000 people. And what managed to happen is it bogged down the system. On top of that, people were then calling the vaccine line, pressing 1 for more help, and it crashed our phone system. It actually literally clogged the system to where we could get no phone calls in or out. So we actually had to kind of reset the whole thing and get the ball rolling. So that was kind of, it was exciting. I mean, I shouldn't say exciting, I guess. That's not the right word, but very frustrating for everyone, I'm sure, and unexpected for us. But, really it was kind of like Ticketmaster with a opening of a U2 concert. It was all of a sudden you had people that were sitting waiting for 3 o'clock, and they were hitting refresh, and you kind of learn quickly about how much bandwidth there is. As of right now, we have over 3,500 people that have been able to sign up for vaccines. We have 30 plus people that are working on calling to schedule those. And these are people whose job it normally isn't to be calling folks. This actually ends up being many of our leaders are making these phone calls. And to give you an idea, I had the letter F, and I had over 150 calls to make. And thankfully I had some assistants that helped me start to do that process. So So that was good, but it's a lot. It's surprising. It's a lot. I mean, I think you plan, do the best you can, and I'm really proud of our team and what we've been able to do. But this is new territory as far as mass vaccination. We really haven't seen this in our lifetimes, and I think in talking with our regional partners down in Green Bay and the Fox Valley, they're experiencing the very same thing. So we'll get there. I think the big thing to understand is that patience is going to truly be required here. We can do about 500 per day when we vaccinate. Public Health, and Sue will tell you in a minute, they've said they can do about 700 per day. And we're going to be set up to where when the second doses begin, which is pretty quick now, the first people a month ago or so, 28 days ago, got their first doses. I just got my second dose today. Then we're going to be vaccinating 1,000 a day. So 500 new, 500 second doses. So that's a lot. But if you do the math with 8,000 people over 65, you can do the math. You're looking at probably a couple of months to get that done. And it sounds like perhaps next week or in the next, I would think it would be next week, there may be some discussions about starting doing the teachers, which will be a great idea. And other, what do they call those?
Essential workers.
Essential workers, sorry, I couldn't think of the word. Essential workers. So this is going to take a while for all of us. We'll get through this, but everybody will get vaccinated. What I have been saying, and I was just talking to the group here before we started, and I really believe what I say, but I sometimes wonder if people think it's kind of nonsense, is, even if you're not able to get vaccinated right this minute or today or tomorrow or even next week, as others are getting vaccinated, we're working toward that herd immunity. We're moving forward. There's already been over 7 or 8 million doses that have been given in the US. So we're moving toward that herd immunity. All of us, even when we've been vaccinated, need to continue to wear masks, continue to physically distance, that sort of thing until we hit herd immunity. So if you keep doing that, I think patients you'll be rewarded with patience as far as getting your vaccine and getting that situated. So Sue, I guess I've talked enough. I'll turn it over to what Public Health is doing and what comments you might have.
Yeah, thanks. So to Jim's point about collaboration, and I think I may have said this last week, the county started a COVID vaccine task force, and that's headed up by our emergency manager, Dan Kane. Thank you, Dan. We've been meeting since November, and that includes Door County Medical Center and other clinics, Aurora, Bellin, EMS, the Fire Chief Coalition, volunteer representatives, other stakeholders that are involved. So we've, from the beginning collaborated, and it does not matter where you get your vaccine, Door County Medical Center or us, wherever you can get it. It came to my attention today that people were signing up both places. I would ask you to please just sign up one. It kind of gums up the works if you cancel, or certainly wouldn't want you to be a no-show at a clinic. Although we would certainly call on our waiting list and use that vaccine. Dr. Heise gave some numbers. He said 700 a day for public health. It's a week.
Yeah, I know, and our chief pharmacist, Amy Conop, also put on here, I was saying 500 a day, it's per week. So yes, thank you, Amy, thank you, Sue.
He's really ambitious.
No, I'm not ambitious, I'm just, hyped up.
So that's our goal. Next week, we won't be doing that many. For the simple fact of the week after is when we will start the second doses, and those will come automatically. So we don't want to put ourselves in a position where we're over capacity. So we are partnering with, Door County Public Health is partnering with not only Dan Kane from Emergency Management, but the county EMS people are the vaccinators. So thank you, Aaron LeClaire and Robin Gordon and all your staff that are helping us out, and those guys are coming in on their days off. So we're trying to make this as sustainable as possible, and we're looking for other options. But for now, that's our plan, and it's working so great. The Fire Chief Coalition volunteers, headed up by Chris Hecht, have been phenomenal, and we couldn't do it without all those people. So we're doing the drive-through clinics. They have worked out really well. The comments we've gotten from the public are that it was a smooth process. Everyone, has it down. We know the procedure. And yeah, we're certainly all going to need to be patient. So there's a couple reasons why. There's, first of all, capacity. I wish we could do more, but we don't have the capacity. We don't
Right.
have the manpower. And then I don't think that we would get the vaccine supply much higher.
Right.
We've been told by the state that the vaccine supply for the next 3 to 4 weeks is going to be flat, meaning we can't get a lot more, and that's from the federal supply. So we'll get roughly the same amount. I hope that the 300 doses I ordered for next week gets, confirmed and delivered, and that we can put those, vaccinate people with those next week. We also have an online scheduler system that we rolled out yesterday, and this morning it was pretty exciting because we had so many messages and a little overwhelming. We got close to caught up by the end of the day, and I was going to check, and I neglected to before I left the office to see whether all our appointment times were scheduled. So we only are scheduling through the month of February. We don't want to get too far out. If we have learned nothing else in this pandemic, it is that things are going to change. We just don't know which direction. We don't want to get ourselves boxed in. So for those appointments, we are planning to use the Sturgeon Bay location for drive-through. We also know that we want to go to Sister Bay as well as Washington Island to serve those folks so they don't have to come way down here, especially Washington Island. And there's, I'm very aware that there's people, teachers on the island, ferry workers, utility workers, all kinds of essential workers. And we'll see, as Dr. Heise said, what the DHS confirms from what the State Disaster Medical Advisory Committee recommended today, whether they take all those recommendations. If teachers are included, I would think they would be.
I hope so.
And then what's the date for that? Is it the week after next? How do we do this? There's also been comments from the state in the health officer information I get that they are working with pharmacies, preliminary planning for pharmacies to partner with schools to provide vaccination there. That's as far as it's gotten. That's all I know. I don't know anything about a timeline or if that's going to be workable in our community. I also learned today a lot about the mobile vaccination teams that we could ask to come and help us. Right now, those teams are just doing inside, in-person clinics, not any drive-through, and we have practiced and polished our drive-through. We're going to stick with that model for now. The capacity of the state mobile vaccination teams is they can help with as many as 100 per day. So that's not a huge help, but it's something for us to keep in mind down the line. Retail pharmacies are in the plan from the state to get vaccine, and we did check with the pharmacies today locally, and none of them have the vaccine yet. A couple are hoping to provide vaccine, but not doing it yet, haven't received a supply.
And I think I was just thinking as you were talking, Sue, about the 700 per week on your end, maybe 1,000, 500 to 1,000 a week on our end. And I know, without really thinking about it, you tend to think it ought to be more than that. I think just people, I'm sure folks in general are thinking, well, shouldn't it go faster than this? And I think when you realize the amount of time it takes, you can do about 3, at least in our setup, you can do about 3 vaccinations every 5 minutes. And you do that for 4.5 hours a day. You could do it longer, but you also have to watch individuals for 15 minutes to make sure. So you have to have room to put people in a realistically spaced environment. So there's so much to this. It really is interesting. And I don't say that as any kind of an excuse. I just, it's kind of interest because this is new for all of us. And so I know I have to congratulate our team of folks that are getting this all situated. They're just doing an amazing job. Michelle Johnson is one of the RNs who is kind of leading this up, and Nancy Doust also, and a lot of names that I would forget to say, but that entire team has just been doing an amazing job, and it's just been really impressive to watch them get this situated. And I know I'm saying with your staff,
Yeah, and
watching everybody do this.
I
is
just want to
amazing.
comment, the collaboration has been so good. So the drive-through setting, we have a lot of safeguards in place. We have EMS and their rig out in the parking area, and they're watching people for 15 minutes, monitoring rather. But if somebody comes through the line and they have a significant allergy with an anaphylaxis history, we're not going to provide vaccine in that situation. It's safer here in a clinic situation. So we've been referring a few people, and boy, Michelle Johnson gets them right on the schedule, and it's really been seamless. I also, if we're going to be bragging about our staff, I have to brag up my contact tracing staff. These are limited term employees that have come on board different times in the last few months, caught on to the whole contact tracing, which is a big lot to learn. And just in the last 2 days, we've said, hey, by the way, do you want to man the phones and make these scheduling appointments and talk to these people? And they are all on board, and they're helping us so much and willing to be flexible, and really appreciate them.
Yeah, and it's been we've had people in tears on the phone, so happy and grateful that they're going to be able to get their vaccine. Let me just see if I can hit a few of these questions that are here. Some are asking, is there a way that the calls should identify from being DC Medical? There's so many scam callers you don't want to answer. We know we do. I mean, we are calling from here, so I'm not really sure why that wouldn't identify it as DC Medical, but we are leaving voicemail messages, so you should get that message. Don't expect that if you filled out the form today that you're going to get a call later, not today, but let's say later tomorrow. It may be a number of days until you get your phone call, but it will happen. And I don't believe the only people that are getting any kind of an email confirmation are those that are on the portal. And they will get an email that basically says you have a new appointment scheduled. But otherwise, there's no particular confirmation. But we're getting all those, and we'll get through them.
We have a little different system for registration. If you log on and you do the online registering for an appointment, you will get a confirmation by email, and you'll also get the vaccine information, the consent form, that if you would like to, you can print and fill out just to sort of speed the process when you get to the clinic, but it's not necessary. The other option, if you aren't on computer, and we know a lot of people aren't, you can just call a special number. And I don't know the number right off the top of my head. It's brand new. I don't have it written down, but it's on our Door County COVID website. And if you call in, one of our wonderful contact tracing staff or one of our wonderful public health regular full-time staff will assist you to make an appointment, and they will mail out the information that you need in the regular U.S. Postal Service mail. So we also have the capability, if you're Spanish speaking, we can use the language line interpretation service and help you make that appointment, and we would like to do that.
And someone had commented, CVS Pharmacy is doing vaccines at Pinecrest on Monday. They're doing it for the Pinecrest residents. It's not a mass clinic for, so the people in community-based residential facilities or assisted living facilities, they're getting vaccinated through pharmacy organizations. Our nursing home, as an example, was Walgreens. And I think Walgreens is doing Cardinal Ridge as well. But regardless, it's happening.
It's sort of a separate state partnership system that was set up.
And then let's see what else. Someone had asked, go back here. Yeah, someone called today to schedule my husband, but he had already scheduled one through public health. I did leave my name and phone number. Okay. There was one. Oh, someone had asked you, and this is a good general question, is there an exception for folks who are not quite 65 but have some complex medical conditions if someone is 63? The simple answer is no. Right now, it's when we talk about the priority groups, we're told who's included in those groups, and it's pretty much black and white. It's you're 65 or older. So anything above 65 and up, you're able to get it. And the reason, and I forget if I said this on a Facebook Live or on the radio or something, but the reason that we have to follow these things so closely is that we've been told in no uncertain terms that if we were to kind of go rogue and do things as we thought we wanted to do, then the state could very easily remove our vaccinator status, and that could affect our vaccines for children as well as the COVID vaccine and other vaccines. And so it's just, you know, I think it's just the government's way of trying to make sure that we're moving forward in a sort of planned, organized way. Someone also had asked, how long after you've gotten your second vaccine are you considered immune? And I want to say it's 2 weeks. Have you heard any different?
No, I haven't heard any different.
Yeah.
And let's talk about that. Were you going to keep talking?
No,
Okay.
Go for it.
So, yeah, you'd be considered immune, but that doesn't mean you don't need to mask or distance or hand wash. And there is just not enough information currently available to say when the experts are going to stop recommending that people vaccinated and the rest of us wear masks and avoid close contact to prevent the spread of the virus. We need to understand more about the protection that the vaccine provides in real life situations outside of the lab where it's been tested. So, and other factors, the disease activity level in a community affect when that will be possible. So, patience.
Yeah, yeah.
And boy, I know we're all tired of it. And I'm looking forward to when we can get back to, doing some social things and seeing people and hugging people. I have been asked, public health has gotten a lot of questions in the last week with the vaccine rollout. When can we plan festivals? When can we plan sporting events? When can we plan our large gathering? And the short answer is not yet. If we've learned nothing in this pandemic is that we can't predict the future. We were talking before we went live, and wasn't it just about a year ago when we thought this was going to stay in China? I would have never imagined
Today
this.
it was a year ago today that the first case in the U.S. was reported. I just saw that statistic, so that was interesting.
Yeah.
Let's see. Someone had asked about with the federal mandate that's coming out from the White House that all federal buildings and national parks and things like that will require masks. What about the county? I would assume it'll just, it wouldn't be us. It would be the county board, I would assume, that would.
Yeah. Well, we've already got that requirement in place. We've had it for a number of months. Can't remember when it started.
Yeah, that's right. It's been a long time. Just another comment about, will public health schedule you the day you get your first vaccine for the second dose?
That's our plan.
That's the plan? Good.
Right. When you go through our drive-through clinic, we will talk with you and achieve that. That seemed to be the most workable process right now. We have worked out a number of glitches already in 24 hours, so things could change. But right now, that's our process. So don't worry about scheduling that second dose. And please come back to us for your second dose if you get your first dose from us, because your second dose will be automatically shipped to us from the state. At this point, that could change. I've heard rumors that that's going to change, but the state says that they are continuing that is possible, at least for the foreseeable future. Same thing with Door County Medical Center. Any vaccine provider will get your second dose shipped to them automatically the week you need it. So. And
what's interesting is someone had asked on here, is public health, do they have both vaccines? Public health is with Pfizer. We have Moderna, and that just was what was allocated to us. It wasn't that we were able to say, hey, I prefer one or the other, because frankly, it didn't matter at all to either one of us. But it's important that your second dose be the same as the first. So if you got Pfizer, 21 days later, that's when you have to get your second Pfizer dose. Moderna, 28 days later, that's when you have to get your Moderna dose. And you also want to make sure that if you're going to try, if you are going to call or schedule yourself to get vaccinated, make sure you're going to be here in 21 days or 28 days. If you say, well, I'm leaving for Bermuda for 2 months, then you should wait to get vaccinated, because you can't come back and then get vaccinated with the second dose. I mean, you probably could, but it wouldn't. It's not effective. I mean, we know it's about 4 days plus or minus is about what the recommendation is. So I'd plan ahead for that. I wouldn't. I wouldn't.
And then there's the vaccine availability issue.
Right.
We don't know how this is going. Yeah.
And then, do you know which vaccine you will get? As Claudette asked that question, I'm assuming, well, right now, if you come here, it's going to be Moderna, and if you go to public health, it'll be Pfizer. And as I say, from my perspective, it didn't matter a lick which vaccine. It really didn't matter at all. They're basically similar concepts, similar technology, just different ways in which they, the Pfizer requires a much colder storage temperature because of how they design their particular little lipid nanoparticle that goes around that's the active part of the vaccine itself. So other than that, there's really no difference. Oh, here, someone put on here, I believe public health scheduling line is 920-746-7180.
That's it. Thank you.
Perfect. Thank you, Ben.
So we didn't get any choice in what brand we get, nor do we know going forward which brand we're going to get. Although the state let me know last week that we'll probably continue to get Pfizer because the pharmacy partnership programs that we talked about with the assisted livings are being sent Moderna because it's a little easier to deal with. It doesn't have that ultra cold storage requirement. Yeah. So health departments are typically getting the Pfizer. And that makes it very interesting because we have to use that vaccine within 120 hours from when it leaves the hub, when it ships out of Green Bay. So when it lands on our doorstep, it's about 119 hours that we have to use that. And so we can't hold any over week to week.
Right.
Yeah.
And someone somewhat related to that, Jean had asked, I've been told that the vials contain more vaccine than expected. If you have extra, will you give it to a waiting list? So the idea is these vials, at least for Moderna, they come in a vial that contains enough for 10 doses. And there have been times where, whatever we do the 10 doses at the right, it's pretty simple as far as drawing up the amount, and there may be an extra dose left. And so we do not waste those. Is there a waiting list? Not so much. I mean, what usually happens is someone else will be there and we're able to give it to them. So it doesn't, you really have to, once you've cracked that bottle, you've got to use it. So it's not as simple as having a waiting list, but it doesn't happen all that often. So, but that there is, I don't know if you've experienced.
Yeah, well, it is a little different with the Pfizer vaccine. Their vials are supposed to be 5 doses, and really, we've been pretty consistently getting 6 doses, maybe 80-90% of the time.
Yeah.
So now we've incorporated that into the plan going forward and scheduled more appointments, so we don't have to scramble at the last minute, but we do have to use that up.
Yeah.
So, and our vaccine scheduler online system does allow for a wait list. So
Perfect. Perfect.
We'll have names to call.
And Larry says, we hear about appointment cancellations due to lack of vaccines. Is that a possibility here in DC? Absolutely. I think what's interesting is this is what you have. This is sort of new. You have a sort of a triumvirate of things that have to happen. You've got mass production, mass distribution, mass administration of all these things. So you have to produce enough that you can get them out, and then you have to somehow distribute them and get them out in the context of very cold conditions for Pfizer and still frozen conditions for Moderna, and then mass administration. And we're finding that with mass administration, that's the part that we're involved in at the ground, at the ground level, and it's tough. I mean, it's people sort of, myself included, I had this idea about the flu shots. I mean, how they're so quick. Well, one of the reasons it's so quick is they're single dose vials. I mean, you literally grab a syringe, go, you throw it away, and someone can leave. And so you can literally do it in seconds. Well, this one, you're drawing them up. You have to give it. You have to have somebody wait. So it's all these three things. The mass part of it is really the what makes it so challenging and new for all of us. And we're talking numbers that are incredibly high. I mean, we have 8,000 or so 65 and older. In the state itself, there are 700,000 people age 65 or older. And if you look, I was just looking on here, if you look at how much vaccine from the state was allocated 779,800 from the beginning. And they ordered 473,000. They've administered 285,000. So if you think 700,000, and that includes the healthcare workers, so it's just going to take a while. So it is a bit of a scarce resource.
I'm glad you brought up those statistics. It's reminding me that's on the Wisconsin Department of Health Services website, and I don't think it's live yet, but they are talking about adding county-specific data. So we'll be able to find out exactly how many doses have been administered in our county, which will be very interesting.
I'm just looking, Northeast region. Yeah, they have a Northeast region.
Okay, by
but it's
region,
just,
yeah.
Okay, let's see. Have they come out with all of the groups yet so people can see ahead of time? No. That'd be nice, wouldn't it? But
I don't know if it would be nice.
Well, yeah, that's true. That's actually true. I mean, but yeah, so I think I know that the conversation is, it should not be, and it really hasn't been, and it won't be. It shouldn't be 1A. You wait till you're done with 1A, then you move to 1B, and you wait till it shouldn't be that way. There should be some overlap because otherwise it's going to get really ugly. So, and we're seeing that already, where 1B was initially just police, unaffiliated physicians or doctors, and then healthcare providers, and then police and fire, and quickly then they added the 65 and older, and now they're talking about adding some more, which is probably a good thing, but I do see in those situations it's going to be a vaccine situation. Are we going to have enough vaccines, and are we going to be able to get vaccines in arms fast enough?
I just have to say, in our own defense, and I don't mean to really sound too defensive, but public health and all the clinics and hospitals across the state have been involved in dealing with the COVID disease and been really busy. And now this is another part of it that we're being asked to do, and it's really challenging.
Yeah, same number of people.
We were already already maxed. Although this is a lot more fun. I'll just say that.
It's a lot more positive,
Yes.
knowing that we're heading in the right direction. And then I think someone had asked where they hold in the drive-through, and so you're holding them in the new ambulance garage in the ADRC?
We are.
Okay. Let's see. Has DC Medical begun to call for Monday vaccinations? Yes, we have. And we've made, I can't tell you exactly how many, but again, we've got 3,500 plus on the list. And I know I've seen a bunch of people calling all day long. So, be patient. I mean, you will get your phone call, but there's no way to be able to do 3,500 in a rapid situation, because what's happening is, as we call, we're asking a few questions like, have you signed up with public health, just so we don't double book, and then we have to go into the scheduling module and actually do it. So it just takes a few seconds to do. Are the multi-dose vial stoppers latex-free? Yes. Latex-free, preservative-free. This is not being a messenger RNA. You don't have to worry about any of those. Everyone worries about thimerosal, which really isn't a valid worry, but it's people worry about that. None of that with these vaccines at all. I think we're actually seeing, I don't know, Sue, if you've gotten a sense of it. I mean, my gestalt is that people are afraid enough of COVID where we're seeing a lot more interest in vaccination for this than perhaps some of the other ones.
Absolutely.
So
it's really
which is
nice.
good. It's a great thing.
Yeah.
The other thing I wanted to bring up from our perspective, from the hospital perspective, it's a different situation with public health than it is being basically a private nonprofit hospital. As far as we've had a lot of people that have asked the question, why are you asking for my insurance information? Isn't this free? And the answer is yes, it's free. I mean, there's no free lunch. I mean, there's no cost to individuals for this at all. So no cost at all. The reason that we take insurance information is that there's a fair amount of infrastructure and costs associated with administering these vaccines. Excuse me. And we aren't funded by the government as public health is, as an example. So we are able to bill for administration through insurances. Insurance is not allowed to pass that cost on to the individual, and the individual will not get a bill for this at all. So I know it may seem like a little bit of a pain in the rear, but that's the reason for it. It's not that you're going to get charged for the vaccine or charged for administration. It's just that this is a highly expensive thing to do. So unless you have funding from the government, you sort of, I mean, and we're not the only ones that are doing this. I mean, everyone else in sort of the business is doing that as well. But that's the reason why. Let's see. Anything else you want to regale us with while I'm looking at
I'm
questions?
thinking about a question I got today a couple times, and that is, well, I guess somebody asked, they said, I think somebody who wasn't over 65 signed up for an appointment, just the screening process. So we will review the appointments and screen as best we can. Some of this is actually the honor system, okay? But when you get to our site, for example, when we did the unaffiliated healthcare providers, we asked for proof that you were actually a healthcare provider in the form of some identification or your name badge from your workplace, that type of thing. So if somebody under 65 has signed up on our site, then are they police, fire, healthcare provider? We'll ask those questions.
Right. Yeah, we're not knowingly doing that because, again, we're really going by what the state has instructed us to do. Two questions that are good are allergies to penicillin, amoxicillin, et cetera, is that going to be a problem? Do you want to take that?
In general, no, but we asked the question, was it something injectable?
Right.
And if so, that's not a contraindication because those things are not in the vaccine, but that's when public health would refer you to get your vaccine at the clinic hospital site for safety reasons. Yeah.
And then someone said, I have a friend who's still worried about the vaccine altering her DNA. Where can I get info for her to read? Boy, that's a good question. What I found is if your friend has access to the internet, YouTube, if you search for what is an mRNA vaccine, it talks about that. I'll just throw out there real quickly, the concept of a messenger RNA vaccine is messenger RNA is what tells, it basically tells the cell what protein to code for. And so the messenger RNA is introduced into the cell and it goes immediately to a part of the cell called the ribosome. And the ribosome then translates it through a bunch of other steps into the spike protein that looks like that which the COVID comes from. So it cannot get into the nucleus. And so that's where the DNA is. In a cell, if you remember your biology, the central hub of the cell is the nucleus. And there's no mechanism for messenger RNA to get into the nucleus. It does its job in other apparatus within the cell itself, and then it dissolves away. It does its job and it's gone. It cannot get into the nucleus. And so there's no way that it can even interact with your DNA. So to the degree that helps.
So one of our awesome public health staff, Chelsea Smees, health educator, made a little video, I forget if it was last week or the week before, about how the vaccines work. And that's on our Facebook site. I just made a note to repost that.
Perfect.
And I know there's basic information on the CDC website, but sometimes that's too basic and you want more.
Right,
Yeah.
right. Karen asks, will taking prednisone alter the effectiveness of the vaccine? I would say no, it does not. In a general sense, when you get a vaccine, you want as intact of an immune system as you can. And what that means is that's kind of one of the reasons why we say don't get the COVID vaccine within 2 weeks of having received another vaccine, like the Shingrix or some other vaccine, because you want the immune system ripe and ready to go to address what you're getting in that vaccine. So it's not that, and prednisone can depress the immune system, but I don't think enough that it would be a concern. That's my best answer to that. So, really the only reason that you shouldn't get the vaccine is if you're in the midst of actually having COVID, because you should be isolated. That's the reason, not because you're sick. You should be isolated. If you have severe anaphylactic reaction to an injectable medication, but even sometimes in those cases we can work with that. And if you've had another vaccine within 2 weeks, or if you've been treated with that monoclonal antibody for a certain amount of time, and I'm right this very minute, I'm blanking.
90 days.
90 days. Thank you. I just had a mind hiccup.
Or the convalescent plasma within
Or
90
convalescent
days.
plasma.
Yeah.
So otherwise, there's really not a great reason not to get it at this point. Let's see. Yeah, Nancy said, can you get it if you got a steroid shot this week? Sure.
So in answering that question, I was thinking about, for whatever reason the person is taking prednisone, they might have an underlying health condition. So that is a reason you really do want the COVID vaccine.
Yes. Good comment. So I'm gonna read this. Paul asks, I think Paul was the one that asked this question before, and he wants an answer. So, are we respecting Governor Evers' order for masks if we allow supervisors who attend meetings at county government meetings unmasked? I mean, I'll just say my answer to that would be no. I mean, no, we're not. I mean, I think everybody should have a mask on in an enclosed space. That doesn't matter who you are. I don't care if you're the president. I don't care if you're the governor. I don't care who you are. I mean, that's what we understand to be the best possible tactics: wearing a mask, avoiding large groups of people in enclosed spaces, and staying 6 feet apart. But as far as what can Sue Powers and myself do about that, I think you're kind of barking up the wrong tree. I mean, that's my take on it.
I guess the other thought I was having is, I don't know if that person has some contraindication to a mask, and I don't know what that would be. There's that caveat: if you have a health condition that you can't wear a mask for some reason, it's okay. But certainly agree with what Dr. Heise said. Anybody in a public place.
You can always tell the nurse answer. It's so much more nurturing and nice.
Trusting.
That's right. That's right. But no, I mean, your point is really well taken, and I'd forgotten about that. There are some times when you shouldn't be wearing a mask. There's not a lot of reasons that you shouldn't wear a mask, but there might be in that situation. A friend of mine had COVID, and she was told she had to wait 90 days until she can get the vaccine. Is that true? No, it's not. You could make the argument that, well, you probably have some degree of immunity from having had COVID, and so you're not in as much of a rush to get it as others. But as far as you can't get it, no, not at all. The only time you can't get it related to COVID is if you're in the middle of COVID and you're isolated.
Or if you've been exposed to COVID and you should be quarantining. We don't want you to come through the drive-through clinic. We want you quarantining.
Same thing.
Yeah.
Good. Well, I think that we've gone through. Hopefully, I've hit all the questions. So, as usual, I just want to thank the audience members for being out there and giving us a watch. And thank you so much for the questions. I think every question that you ask helps other people in the community. So, I really appreciate that. And Sue, as always, a pleasure. Thank you so much.
Thank you.
And we'll see how things progress. So, we're happy to do this weekly. It's sometimes, I look at the end of this. I made this comment last week. I look at the end of this, after this, to see over the course of a few days how many views it's had, just to try and get a sense of, is this helpful for people? Because we're happy to do it, but I don't want to bore people and do it if it's not helpful. So we will be here if it makes sense to be here. So in the meantime, be patient. Everyone's going to get vaccinated. And I wish you all the best. And thanks so much for joining us. Take care.